Alright, welcome back everybody. Today Anna is here. She's going to get a full spine adjustment, and she's been focusing on a certain area where she's doing a lot of ultrasound, she's writing a lot, she's working so hard here, and she's had a little discomfort up here, correct Anna?
Yep.
Yeah, so, some upper back and trap tension. And when do you feel it the most? At the end of the day, the beginning of the day?
End of the day.
End of the day. So it's kind of a part of her pattern where she's working a lot with her hands and bending over a lot. And at the end of the day, she's got a lot of tension in her upper back and trap. So we're going to adjust some of the joints that are stiff in her upper back and in her neck. And then we're going to show you some dry needling that we do for people that come in with some of that upper back tension and neck tension. All right, you ready?
Let's do it.
Let's do it. All right, come on your back for me. Start on your back. So you're going back to College Park to finish up school, aren't you?
Oh yeah.
And what are you going to do after that?
Hopefully physical therapy.
You hear that?
School.
Oh yeah, Baltimore horn.
Oh yeah.
Oh yeah. You're going to go to where?
Physical therapy school.
That's awesome.
Baltimore.
In Baltimore, there's a. I'm going to take your hands and drag you up a little bit. Got it all. So the school is in downtown Baltimore, correct?
Mm-hmm.
And that is awesome. We've had CAs that go into chiropractic school, and we've had CAs that go into physical therapy school.
And nursing.
And nursing as well. Joyce, yep, she went
And
over
Courtney.
to. And Courtney.
Just applied.
So many. So what I'm doing is I'm checking for any joint mobility issues in her neck, and she's got a little bit of tension in her upper cervical spine. So I'm going to do an adjustment for that area up here. So let's go ahead and relax for me. What I like to do is a little bit of soft tissue work and on these suboccipital muscles, but also what I like to do is something called PIR, or passive inhibition relaxation. So what I want you to do is turn your head into my hand over here. You hold that for about 5 seconds and relax. Allow some of those muscles that might be just chronically tight to start to ease in and relax, and lets me adjust her a lot smoother. How'd that feel, Anna?
Yeah, much better.
So this time I want you to rock your head back for me and relax. Nice and loose through here. Good. All right, and then we do an upper back adjustment. You're going to turn your head over here. So when we do this adjustment, we're looking for tension in the upper back. We're looking for pain when we palpate the upper back. And usually what we call like an upper cross syndrome posture, where the head is a little bit tilted forward, we've got tension in the trap and the levator scap muscle, and they'll point to some tenderness in that upper back region, right? So with this adjustment, we're adjusting the upper ribs and the upper thoracic spine, okay? It's not a very hard adjustment, it's very gentle. It's my body weight that's creating the force, and my hand is placed behind on those joints, okay? So reach across, hold on to my opposite shoulder. I allow this area to open up. I place my hand in nice and gently. I roll forward, nice and relaxed. Let her body relax under my hand and drop. How was that? It's good?
Mm-hmm.
All right. I want to put words in your mouth. Turn your head over here for me. Good. Reach, hold, relax through. Let your chest relax. Good. Nice and easy. Good?
Yeah.
And loose?
Yes.
All right. Alright, so now we're going to go over and we're going to do some dry needling for the very first time.
Oh boy.
Party. And we'll see how she likes that. So let's go on over. Alright, Anna's here. We're going to do some of the dry needling that we talked about. So the areas that we're going to work on is some of that tension that she has in her upper back and upper trap. And we're going to come around the joints as well in her upper thoracic spine, okay? So the reason that we do dry needling, one, is to decrease pain if they have pain in the area. Two, it helps with mobility of the tissue, so we have a direct effect mechanically on the fascia and the muscles, right? And three, it drives healing to an area, right? The body responds to the needle, it drives healing to that area, right? So those are the three main reasons that we do dry needling. All right, so go ahead on your stomach, Anna. And we do a lot of work with the CAs because a lot of them are going off to chiropractic school. We have 2 CAs that are going to be in chiropractic school. Anna's going to be doing physical therapy. So we spend Thursdays and we kind of collaborate as a group, and we do some type of educational event with them. So 3 weeks ago, we did McKenzie technique. We went through some of the McKenzie protocols and exercises, and then 2 weeks ago, or a week after that, we did some diaphragmatic breathing. We talked about core stability and how important that is, and people that have low back pain. And now all of our patients are going through some type of breathing protocol, pelvic floor stabilization, and then they get their core exercises. So we really upgrade that side of things. And we're really excited rolling forward some of the strength training that we do here when people get out of pain, right? We have a lot of techniques that give us a great window for people to feel good, to move well, right? They're out of pain. Now we add that in with some really good strengthening exercise and good mobility work. And those two things together are what create great results. So we're really excited to start making that more of a focus, and it already really is a strong focus here in the practice. So, Anna.
Yeah.
Do you learn some things on Thursdays?
Lots of things.
Lots of things?
Lots.
That's good to hear. Are you excited to get dry needled?
I'm nervous.
You're nervous. A lot of people are nervous for the first time. There's no doubt. You might feel a little pinch with the needle going in, right? And if you've had it done before, there's a lot of different experiences you can have with the needle, right? You might have been to an acupuncturist, they might have used a similar type of needle, or you might have been to like a physical therapist, and they might have tried dry needling with you. Some techniques revolve around the idea of really manipulating the needle, moving it up and down. They call it tenting, spinning. Here at the office, we do much more of a calming type technique, even though it is really much more one of the intense things that we do here, right? We're piercing the skin, right? But we definitely make sure that we set them and we leave them. We're looking for tension within the tissues and trigger points to hit within the tissues as well. So we want to make sure that we're palpating the area. We definitely have a little bit of tension here. And this is her levator scap that I'm feeling, right? And her upper trap. And there's common areas that trigger points will fall. It's quite interesting. So we want to look in those areas to see if we can find some of those tension points. So set the needle, little tap. She might have felt it going a little bit, and she probably won't feel until it's pulling at the very end there. Did you feel that going in at all, Anna?
A little bit.
How was it?
It was not that bad.
Not that bad. Right?
Mm-hmm.
Change your expectations a little bit. So we work around the first thoracic vertebra here. Nice and gentle in our approach, not slamming the needle in. We don't go and twist the needle or tent the needle afterwards. And some of our approach comes from Ma, who wrote a book about dry needlings. And I had my training out in St. Louis with Dr. Eric Mitz, and we went over a broad-based history on traditional Chinese acupuncture, and then we went into trigger point dry needling and spent quite amount of time needling every single muscle in the entire body. So needless to say, I felt really good maybe 3 or 4 days after that weekend, but I was definitely very sore on Monday. Sometimes you can get some soreness with dry needling, right? Your body's responding to that area almost like you would have a workout. So that's what people describe it as. Like, I felt like I had a workout in that area, like a post-workout soreness, right? How you doing so far?
Pretty good.
Good. So we do some of the erector spinae group here and her cervical spine. You've seen these ones that I'm putting in the middle, working the interspinous ligament between the joints. Right, and now we'll come over to some of those muscles that are a little bit more tense along the outside.
Oh boy.
Oh boy. How you doing so far?
Good.
Alright. So what we'll usually do with someone that comes into the office that gets dry needled, we'll put some heat on them afterwards, right? We'll tell them to drink plenty of water, just like if you were to go and have a massage. You know, that massage therapist might tell you to drink plenty of water. It's just good to stay hydrated anytime you're working with soft tissues in the body, right? You might feel a little bit of a trigger point in this area here, Anna.
Mm-hmm.
You feel that little twitch underneath my finger? So usually in the upper trap band, when you have tension along that muscle, maybe shoulder mechanics aren't ideal, right? Maybe she's got a little room for improvement and good joint centration in the shoulder, and she's loading her neck muscles a little bit too much during her day-to-day activities. Your body, a good way to look at a trigger pointer or not is a good thing in a poorly functioning system, right? So we need to really focus on the active care, right? Making sure that she has endurance for her work, right? A lot of people that come in, say they're nurses, they're ER nurses, at the end of the day, they're like, oh, that's when I have my pain the worst, right? That's when I'm hurting the most. And we talk to them about being, look at your job as your sport, right? You need to be strong for your sport. You need to be able to make sure you have endurance in some of those muscles in your back and your shoulders for your sport. So this doesn't become a recurrent thing, right? So Jonathan and Sebastian and the rest of the CAs are doing a really great job of implementing some of our strengthening endurance type activities on our rehabilitation floor and allowing patients to get even better results and even faster. So we do a levator scap insertion. She might feel a little twinge here. You might say, well, why aren't you sticking that needle as far in over here? There's some structures here like we want to avoid, kind of like, the lung. We don't want to pierce that. Right? You sure? Mm-hmm. Okay. So we make sure that we stay shallow along those areas, make sure we're riding along the rib heads, because we really like it. Anna working for us, she does a great job.
Thank you.
You know how many patients like working with you, Anna? It's great. We get so many compliments.
Oh boy. I enjoy it.
Yeah, it's a lot of fun. I'm excited for Anna going into school to become a physical therapist. I think it's an absolutely amazing profession. We were just up at a seminar this weekend, and myself and a doctor of physical therapy that worked at a place outside of Frederick at Rehab to Perform. Amazing place. We had an amazing great conversation about chronic pain, right? And some of the modalities that we use in our different fields. They really do have a great profession. Anna's going to serve that world very well. She's well equipped to do great in school, aren't you, Anna?
Thank you.
You're welcome. All right, so we're going to leave these in for 15 minutes. We're going to come back and take them off. We're going to put a little heat on her to make sure that area is nice and loose afterwards. That make sure she's not too sore the following day. And we'll follow up with care 2 days from now to see how she's feeling, right? And then implement some active care. And so you'll be a part of that process and showing some of the exercises that we do here to stabilize shoulders and take some tension off some of these muscles in the neck, right? So we look forward to having you back. Again, thank you so much for watching. We appreciate the support. And if you're still tuning in right now, be on the lookout for episode 1 of Chiropractors. Dr. Blake had me eat the spiciest wings in the world last Friday, and it is hilarious, and it's going to be a really fun episode to watch. So, and he interviews me during the whole process and kind of picks my brain about chiropractic school, my journey through getting up to chiropractic school, and why I love to work where I do, which is awesome. So, thanks again for watching. Have a good night.